The next that we have is with the title Exploring the Critical Medico-Legal Aspects of Dental Practice and How to Navigate Them Effectively. So for that, I'd like to invite Dr. Vishwas V. Puranik. He's with us today. He's a distinguished figure in the dental field, holding a BDS from Mumbai and an LLB. He has extensive qualifications, including a fellowship in implantology and a postgraduate diploma in medico-legal systems. Dr. Puranik has served as the honorary dental surgeon at Dombivli Kalyan Municipal Corporation and has been a panel doctor for prestigious organizations like Air India and ONGC. Notably, Dr. Puranik has held esteemed positions such as President of the Indian Dental Association, Maharashtra State Branch, and President of the Indian Dental Association nationally. He has chaired the World Dental Show and has been a Central Council member since 1996. His contribution extends internationally as Vice Chairman of the International Committee since 1922. In addition to his professional roles, Dr. Puranik is a celebrated speaker, having lectured at dental colleges and conferences across various levels. He has been recognized with numerous awards, including the Dombivli Dhanvantari Award and the Lifetime Achievement Award from IDA. So, sir, we request you to kindly take the session forward.
First of all, thank you very much, Kao, for inviting me, especially Dr. Sharat Shetty for inviting me to take the participation in this. Tushar said that 15 minutes are very less to cover this topic, but Tushar has done the major work that whatever work, if you don't follow the Tushar slides, Tushar has shown the number of slides, if you don't take the safety, you don't take the safety of the patient, if you don't take the safety of the clinic, what you end is the medico-legal problems. If you don't follow this thing, then you will have to get a notice one day, and then you will have to pay for it. When you talk about the medico-legal things, these are the topics comes in the medico-legal, and each topic is for 1 hour. Negligence, communication, medical ethics, case history, dental record, general laws, criminal laws, documentation, sports dentistry, consent, defamation, biomedical waste, consumer protection and Indian evidence and the National Dental Council. As I shown this slide, you must know the laws of the nation. You must know laws of your profession. So most of the time when I go to lectures, they ask me how much knowledge we should have. So basically you should have how our constitution is there, how that law of the parliament, the amendment of the constitution, the Supreme Court judgment and the fundamental rights. These are the basic things of our law of our nation. And in addition to that, you must know the laws of your profession, called as a National Dental Commission now. Previously, it was a National Dental Council. Now it has become a National Dental. Now, what you mean by medico-legal case? It is in simple language. It can be a patient has a history of fall. He comes to your clinic and he says that his front tooth is damaged or it is fall off. You have to inquire him because he might say that it is a fall, but it might be a fight. So it is the responsibility of the dental surgeon to see that whether it is a real fall or a fight. And in that case, if a slightest doubt is there with him, he will have to go to or he has to inform to the police that such and such things has happened. Not doing this thing, you are liable because this is what is called as a medico-legal case. This can be of number of ways that brought by the police for the examination because you are a expert in this, then they already register where you have to go to the hospitals or police stations or the directive of the court where court will send the patient to you saying that asking your expert opinion for whether this is a medico-legal case or what has exactly happened. The same way, these are all the extrinsic. In the clinic also, if Tushar has shown the slide where the file is broken or you have a slip or the instrument has gone in the throat or anything happens, mishap has happened, where you are either directly or vicariously you are liable, and that is what is a medico-legal case. So doctors are receiving the case of number of ways. We will not go into the details because in 15 minutes it's very, very difficult to See, what is really important is when such type of patients to come to you, you must take the history, you have to follow everything. But the most important thing is that first you have to do the life saving. Whatever the life saving is there, you must save the patient's life. And that is the thing. All the doctors, including the dentist, should know the emergency dental practice. You cannot say that I am just dental dentist. I can do a good root canal. I can put implant. I can do filling, but I cannot save the life of the patient. But the law says that as a doctor, you must know the emergency dental. That means you have to have all instruments. You have to have ambu bag. You have to have emergency medicines. You have to have a life support. All these things are required when emergency happens in your dental clinic, and then only you can go for the next thing where you want to go for a specialized thing like implants, like aesthetic dentistry. But people are forgetting that being a doctor, you must know the emergency treatment, emergency medical treatment, and you must follow it. Now, how much you should know? You should know the concept. Everybody knows it. I am right track? You are listening it, madam? Archana? You are getting it or not?
So understanding it and taking it.
Okay, okay. No matter what happened in once it happened, and I was talking for 3 hours, and then ultimately I came to know that nobody was knowing anything, was something has happened in that time. Because that's why in every now and then we have to ask whether I'm on the right track, whether you can hurt me or not. So the consent, negligence, vicarious liability, records, and damages are the basic things, and everybody should know what is the patient. Once the patient comes to you, it becomes a agreement between you that patient is come and he has consented. But what is important is the express, what is the written consent you must take. And after the written consent, you must have a informed consent. That means what treatment you are going to give patient, for what purpose patient has to come. You have to explain plus and minus points of the each treatment. When you're talking about implants, you have to talk about the implant failures, what the patient care has to be taken. This is what is called as informed consent, and that is the most important thing. You just cannot take the signature of the patient on the case paper and say that yes, patient has consented. That is not the right way, and that is not legally valid also. Implied is oral, express is written, informed, and then they say patient specific. That means if you are going to do the root canal on the right, left six, you have to write on the case paper, and then you are restricted to do that much consent only. If you want to do another things, then it becomes you have to take a consent for the next treatment or whatever the treatment you are going to follow. So it is cannot be a consent for everything. So written consent should be specific, language understood by the patient, signature of the patient, risks involved, side effects. Effects should be when voluntary consent. Use of simple language. Patient should understand what you are speaking. That is what the law says. Allowing adequate time from the question. Patient are allowed to ask the questions. You cannot say that I am doctor and then you cannot ask the questions because it's time consuming. No, you have to satisfy the patient then and then only you can start or continue the patient. Voluntary consent, no misleading information. No, cannot say that once you do root canal, lifetime you don't have problem. That is what is called as a misleading information. You have to say that it is for some years, it can happen like this, it can have any problems also, but nothing is lifetime, and don't assure patient like that. Patient with the fully aware of procedure will not go into any anesthesia for any surgery anytime is a blanket consent, and such type of consent is invalid. So when patient comes to you and then you take the consent on the paper and say that patient has consented, it is a blanket consent, it is invalid consent. So many cases are there, but we have no time to talk about this. There are so many cases has happened in India and abroad where because of the consent or because of the wrong consent, they have to pay for the court. Or informed refusal is another important thing, because when patient comes to you, you are talking about feeling that the patient this particular tooth can be saved by doing root canal, and patient insists that no, I want to remove this because I don't believe in root canal, or so many reasons is give. In such cases, before you remove the tooth, you must write on your case paper that patient has been explained for going to root canal and patient has refused, And that is the reason you are removing the tooth, because afterwards, after removing the tooth, he might say that this tooth would have saved. Why you have removed my tooth? Because that is important thing. Whenever you explain everything, you have to explain before giving to partial denture, before giving to implant, and then if you refuse this, write on the case paper. Writing everything on case paper is more important, most important thing. That is what is called as a documentation, and that documentation is valid in the court. It court always asks that whether such type of things you have told to the patient, if you are told to the patient on what date and what time you are explained to the patient, and you have to write on the case paper every detail what you are going to explain. That is most important thing in documentation. Documentation itself is a 1 hour topic, and is a consent is also 1 hour topic. And then this topic has to be talked in detail with the case notes, because there are so many cases of, because of no documentation, patient has to pay from the notes. So what is negligence and trespass? If you don't take consent of the patient, it becomes a negligence. Without the permission of the patient, if you are doing some procedure, it is the trespassing of the person. Doing what is required to be done, act of omission. Doing what is prohibited to be done, this is in simple language, it is a negligence. Not doing the things which are supposed to be done. This is a basic thing. Proper sterilization of the procedure. You have to have a good sterilization, and you must explain that in my clinic, these are the things. Disposable materials, needle, gloves, glasses, proper fumigation in surgical area, sterilization and disposable things, napkins, everything. Doing which are not supposed to be in surgical procedure without x-rays. Nowadays, sometimes patient feels that the tooth is mobile, and if you remove the tooth, and later on he says that you have removed good tooth, unnecessary, because without x-ray you cannot prove it. That is the reason. Once the patient comes, minimum required thing is IOPA, which costs minimum things. The court is going to ask you why you are not taken X-ray, which costs minimum. Court doesn't explain that CT scan and big other things, but they will always stick to this, that we want a basic thing, whether patient pays for it or patient doesn't pay it. Before you start the treatment, before you remove the treatment, before you start with the root canal, how much you are expert is not important. Some people say that we are expert, we can do without x-rays also, but court doesn't believe in this. So follow this thing, that procedure without x-rays and investigations. Administration in GI, in dental office, everybody knows that doing specialized treatment without proper qualification and experience, all these are called as a negligence. Removal of the wrong tooth, fracture maxillary tooth, operating at the wrong side, these are all doctrine of res ipsa loquitur. Res ipsa loquitur means you have done the things, now you cannot say, because once you have removed the tooth, and if you have proved that it is a wrong tooth you have removed, that you cannot say that I have not removed the teeth. Or if you see that the instrument is broken, the tooth is fractured, the fracture mandible happens, the tooth is slipped in the sinus, all this called as a doctrine res ipsa loquitur. You cannot say no to it. It has happened like that. Now you have to follow for the next thing. Definition of documentation, collection of the data on the patient, including this. After the consent, as I told you, the documentation is the most important thing. And weak documentation is a weak evidence. No documentation is no evidence. If you go into the court, if you have to pull in the court, and if you say that I have no time to do the documentation, that indicates that if there is no documentation, you cannot prove it, and you have to pay for it. So documentation is most important. Your documentation and the record are the most important things. And whenever patient comes to you, each and every procedure, each and everything, today you have done root canal open, you must write root canal open. Today you are given dressing, you must write dressing has been given. This is what is called as a documentation. Do and don't in documentation. Don't destroy the evidence. Don't ever change the record. Don't label any addition to the chart as late entry time. And once you do the record, once you do the documentation, don't change it, don't rub it. If you feel that this procedure has been left to do it, you write on down. Next thing, that on such and such day I have done this thing, and this can be followed, but don't rub out the things, don't try to change the things. that will create a bad impression, and that is a bad documentation. So documentation has to be a serial one. 1, 2, 3, 4, like that, it has to be there, and it cannot be changed like this. So documentary evidence, most important thing is whenever patient comes to you, always you think that this is a potential litigant, and try to think that you have to create evidence. What is the evidence? Documentary evidence. That means you are going to write everything on the case paper. Medical reports, you must have x-rays, mocks, whatever the documents you are having, OPG, everything you must preserve that. Medical certificate, oral evidence, case papers, radiograph, models, investigation report, receipt, bill, everything you must preserve. How much it should be preserved? In normal case, it has to be kept all this case paper for 3 years. If you don't do these things, you are liable under law. Right of pictures. Many people are saying that I have treated this celebrity, and then they show the pictures. The law says that without the permission of the patient, you cannot document it. You cannot take the video recording. You cannot show it to others, because there are certain restriction on it. You have to take the permission of the patient, and after taking the permission also, you cannot say that it should not be non-recognition. That means you cannot say that this particular patient or name of the patient, it is not valid. So right of the pictures of the recording is very important. Whenever if you want to show, you must take the patient permission. And after taking the permission also, you have to put such a way that nobody can recognize the patient. You cannot say that this is a celebrity. Many people are doing that, but it is the against of law. Right of confidentiality, again, in most important thing. Many people are proud of saying that I have treated such and such, this lady, I have treated her front, she was not having front teeth, or she was having a very ahead of teeth. I have done a good orthodontic treatment, I have put implant, I have done aesthetic treatment. So this is a impingement of the confidentiality. Right of confidentiality of the patient is taken away, and in that case you are liable. So don't disclose such a matter. Don't disclose such things to the father, to mother, to child, to wife, to husband. It's not allowed, and it is against the law. Medical part to be taken, keep full accurate medical records, employees diagnosis to be confirmed by the laboratory test, proper investigations. All these are important things. What is communication? Most important thing. Tushara, or I think earlier earlier doctor has also shown about the communication. Most important thing is the communication. You must have a knack of communicating the patient. If you communicate well, if you spend time with the patient well, then your medical legal problems will definitely come down. Don't say that I want to say the 10 patient, 15 patient, that's why I don't have time. I have very busy practice. Somebody talks about it. And because of the bad communication, patient gets the opportunity to go against you. So communication itself is a very big topic, very important topic, but it is very neglected topic. People say we don't have time to talk. Some assistant talks with the patient. And when the basic idea of the treatment is something else, and after the treatment patient feels it's wrong, and that is the medical negligence, or patient has the opportunity to go to the court. Always think ahead of what you are going to do. Use simple words and phrases. Increase your knowledge on subject. Speak clearly and audibly. Check twice with the listener whether you have been understood accurately or not. See that patient is understanding the thing. Now you can hear with me, Archana. It's good. Communication is really all anyone ever paid for ultimately. If you cannot effectively communicate, if you have a good communicator, if you have good communications, you will get rewards, you will get payment for it. But if you don't do it, you will have to pay in the court, and that is a much more sizable thing. Result of poor listening. Amongst the communication, they say that listening is more important, where it's very difficult. Listening is very difficult. We go on talking to the patient, but we hardly listen. Moment patient opens his mouth and sees it, I got a pain. We say, yes, we know what has happened and everything. We don't allow him to talk about it. Law says it is bad. You have to listen to the patient. Let him talk about from where he started the pain 4 days back, when he was traveling in the train and all these things. You might have little more time spending on it. But in terms of once the patient agree for all these things, he will pay for everything. So amongst the communication, listening is very important. These are the some of the cases. Summons from the court. If all doing, taking the care of the consent, taking care of the documentation, there